I'm Kieran Anderson, group publisher here at Applied Radiology, and I am sitting here at RSNA, and I've got the pleasure of having Kyle Fry in my booth. Kyle is the CEO of Cortex AI. Kyle, thanks for joining us.
Yeah, thanks for having me, Kieran. Pleasure to be here.
Really exciting to kind of hear about all the things you guys are doing at Cortex, and we've spoken to some of your colleagues about neuroquant for brain tumors and MS, and I'd love to hear you a little bit more about OnQ Prostate and what's that all about and what makes that sort of unique in this market.
As we kind of maybe talked a little bit about in the beginning is, people know Cortex for neuroquant, right? We're pioneering, we're industry leading. We really have that brand awareness around neuroquant. But what people don't know is that, and they're starting to find out, is our OnQ Prostate product, which really utilizes technology that is patented technology we have direct access to, which is called RSI, restrictive spectrum imaging. And so what does that mean? Well, in today's landscape with prostate, which is kind of crazy to think about, there's like 40% of biopsies on patients are done that are not needed.
Wow.
And a lot of that goes to the fact that it's very subjective to look at PI-RADS scoring as how you look at prostate. So radiologists look at it, they're very good at what they do, but sometimes having some additional technology that can allow them to utilize it to actually help in the diagnosis is a big deal. Difference in a PI-RADS of 3 and 4 is a big deal, again, depending on which radiologist is looking at it. But what we really help do is bring together both sides. The urologist that is seeing these patients, that owns that patient's journey, right? And then the radiologist that's trying to make sure that they're identifying oncology, identifying cancer or potential cancer. And so when you bring both parties together, that's where OnQ Prostate comes into play. It actually allows the oncologist, the radiation oncologist, the urologist, and the radiologist to all work together and actually treat this patient. That with our RSI, we're able to really be very specific and look at those pieces within the prostate to help aid in that diagnosis, to call out that cancer potential there.
Well, that's really so important. I mean, because in the sort of continuum of care, right, these patients are seeing multiple people, right? And everybody plays an important role in that process. What would you say is like sort of, the biggest clinical value that OnQ Prostate brings to the radiologist? Because that's who we're talking to today.
Yep.
From Applied Radiology.
Yep. The biggest piece for the radiologist is you don't have to adjust what you do in your standard reading. What we are doing is enhancing the workflow. We're giving you that additional capability to when you look at it and say, I don't know how I feel about that you can go and look at the OnQ Prostate. You can actually go and look at the RSI technology and really feel confident in your diagnosis, or to be able to go in and make an adjustment. And so what you'll hear from a lot of our radiologists that are utilizing OnQ Prostate is that it becomes their side, right by there. It's by their side every time that they're looking at a prostate exam, that they want to have the RSI there. That enhanced diffusion imaging really brings that additional value for the radiologist when they look to be able to help make their diagnosis. But the other piece that is so important is that when they have the dialogue with the urologist, which they have to do, they can actually help to show where they have pinpointed the disease state. And they can actually work together, because that's what happens after you may have cancer, you may have the biopsy, you may have that removed and looked at, and you have that treatment, you're gonna get additional scans, right? And so now you're really creating that connection and that ability to have that great communication, and you're not having to lose time in what you're doing, and you're really helping to make that better, more accurate, more specific diagnosis to help that patient.
Right, and I think you mentioned the oncologist there, the urologist there. Those are your referring physicians in this sort of triangle of who's taking care of this patient. Yeah. How does OnQ Prostate continue to add value to these referring physicians?
It's paramount that they want it. So you look at, we were just talking about our neuro capabilities. Neurologists are saying, I can't not be able to see how I can treat a patient without having neuroquant MS to be able to look at the brain, tumor side with neurosurgery or radiation oncology. Is that is the beauty of what we do, is that we are bridging that referring network to where a urologist, A neurologist isn't used to looking at black and white images, and neither is a urologist. But guess what? A urologist is going in to go in and treat and biopsy, so they really, really need that RSI technology when they go to navigate, ablate, to treat. It's such a big part of that continuum of care.
Right.
So having that referring provider to have that connection with the radiologist and utilize OnQ Prostate, make sure that those patients are really coming in to be seen by that hospital, that imaging center with those radiologists. And so it's very paramount in that continued success, because it's not just helping to, read and look at and interpret, it's helping the urologist so they know how to treat. And then it's helping that patient to make sure they're getting the treatment. And then the urologist feels so much more comfortable in that. You hear a lot from urologists, well, I don't know, I'm getting this score from this radiologist. I don't know. This is the technology that helps them to feel comfortable that yes, what was called out, they feel comfortable with, and they can then be able to articulate that to the patient. You or I that could potentially be sitting in that room.
Do you envision this really becoming sort of like the future of prostate care? I mean, it sounds to me like it's certainly already impacting it today. Where does it go from here?
This is one of those pieces that I'm so excited about. When I joined the organization about 9 months ago, our OnQ Prostate journey was really just beginning, and we've really helped to put resources and put energy behind it to help educate the market, right? Part of this is you have to educate people so they understand what you do. And for us, we've been met with overwhelming arms to say, hey, we want to learn more. We want to be able to bring this in because, to your point, we do see this as being a standard of care going, forward, is that there's been so much AI and technology that's really been put in the brain, right? And we believe we've really kind of been at the forefront of that. And it's now to give, other body parts that technology. And we see prostate being a wonderful world where we will see RSI technology or OnQ Prostate being used as the standard of care each and every month and quarter and year as we go, because it's not taking more time on the scanner. It's not adding additional time to look at something. It's really building into what that workflow is already today.
Well, that's fascinating, and I'm so glad you were able to stop by and tell us here at Applied Radiology a little bit more about OnQ Prostate, what this means, for your radiologists out there, but as you said, also the oncologist and also the urologist, and ultimately the patient. This is an exciting place to be, Kyle.
Yeah, we're very excited to be able to talk about it with you, and we're excited to be able to share it with the market. So thanks for giving us the opportunity.
It's our pleasure. Kyle Fry, CEO, Cortex AI. Thanks again for joining us here at Applied Radiology.
Thanks, Kieran.
Bye-bye.